again, the U.S. is now reporting more than 500,000 new cases of COVID a day. That is more than twice the previous record set during last winter's surge. Joining me now with the latest on these skyrocketing case numbers is oncology physician Dr. Shikha Jain. She's also an assistant professor of medicine at the University of Illinois Cancer Center in Chicago. Welcome back to BNC, Doctor. Good to see you. The CDC now recommending the Pfizer booster shots for children as young as 12. So, Doctor, how is this going to help in the fight against this latest surge in numbers and cases that we're seeing?
Thanks for having me back, Laverne. So you're absolutely right. These boosters will help us get over the hump of this surge. And the way boosters for both kids and adults are going to help is we're going to help stop the spread of the more contagious Omicron variant that we're seeing probably drive a lot of these numbers along with the Delta variant that was already surging. So we know that when you get a booster, you are less likely to get the Omicron variant. And we also know that if you are triple dosed, if you're triple vaccinated, if you've gotten that booster, then you're less likely to get a severe illness and less likely to need to be hospitalized if you contract COVID. So these boosters are really important in helping us prevent the spread of COVID-19 and also helping us prevent people from getting admitted to the hospital if they do end up contracting this more contagious variant, especially.
And Dr. Jane, I really think that people are getting the message about the boosters, but I still feel like people really don't understand what the booster is and what the side effects are. Is it different from the first vaccination? Explain what that booster is.
So the booster is the same shot you got before. It's just kind of ramping up your immune system. So if you think about it, your immune system works by creating these different memory cells and immune cells that if they see the virus coming, they recognize it and they say, hey, not in this body. And it attacks the virus, gets rid of it, and makes you less sick, makes it less likely for you to get very ill. But in our immune system, eventually those cells and those memory cells may go away. So the point of this booster is to help kind of rev up your immune system again, to give it a reminder of what this virus looks like and what it needs to do when the virus shows up. So most people who are getting the booster, they have side effects similar to their first or second shot. Usually people are saying they get a little bit fatigued, maybe a little bit, tired, maybe a little bit run down, but for the most part, people are not having significant side effects from the booster, especially if they tolerated those first two shots very well, or in the case of the Johnson & Johnson if they got the one shot. So usually people aren't having very severe side effects from getting the booster. It's very comparable to what it was like when you got your first series of shots.
So these booster shots and the vaccine as a whole, it is effective against these different variants, of course, the Omicron and the Delta, and who knows now there's another one on the horizon. Getting this shot is going to help protect you against all of these strains?
Absolutely. We're seeing with the Omicron variant, with the Delta variant, these vaccines are very effective. I get asked all the time, well, I was triple vaccinated and I got COVID. The vaccine didn't work. That is not true. The purpose of the vaccines is to prevent you from getting very ill. And when you are not vaccinated and when you are not boosted, the chance of you getting very sick if you contract COVID is more likely. We're seeing people who've been triple vaccinated, who've gotten their booster, get COVID, but they are not getting very sick. They're not being admitted to the hospital. So the vaccines are absolutely working the way they are supposed to. They are supposed to prevent you from getting very sick from COVID-19, which is exactly what they are doing.
So we are seeing, record numbers of people being admitted to the hospital. We're also seeing more people getting vaccinated. So how long is this surge going to last? Are we still in a situation where we just don't know how long this is going to keep going?
That's a great question. And I wish I knew the answer to how long this surge is going to last. We've had experts saying it's going to peak in the middle of January, some saying it's going to peak at the end of January, some saying it's going to last until March. I think a lot of it really depends on how many people we can get vaccinated and how many people we can get boosted, because the people admitted to the hospital are the people who are either unvaccinated or people who have other medical problems that result in them not being able to mount as significant of an immune response. So, for example, people people who are immunocompromised. So we really need to get our vaccine numbers up across the country in order to get through this surge and in order to prevent further surges from happening. My hope is that because Omicron is so contagious, we start to see this surge end at the end of the month. But again, a lot is going to depend on how our nation does as a whole, how many people we get vaccinated, and also if we see any other variants coming down the line. As I am sure you feel the same as we do, anytime we make a prediction about COVID, a new variant shows up or something else happens. So at this point, we know what works. Getting people vaccinated, wearing masks, especially indoors, wearing good masks, not those cloth masks, but upgrading to an N95 or a KF94 or a K95. Those are the things that really work, having good ventilation. So I'd like to say that I could predict that this surge will only last a few weeks, but I can't say that for sure because you never know what's going to happen with this pandemic. The only thing that's certain is that these vaccines are still working right now. These masks are working, and we need to double down on those efforts to get through this surge and hopefully end it soon.
Well, I hope people take your awesome advice. Thank you so much for joining us. As always, Dr. Shikha Jain, oncologist from Chicago. Take care. And the Grammys postponed, and Sundance Festival is going